Hello, welcome to this video. So, not everyone is a trained medical professional, and however, in OET exam, you are expected to demonstrate your ability as one. So, that's include your language ability. Does this mean you can use medical terms all the time to show how knowledgeable you are? Well, the answer is yes and no. So, let me explain you. As a trained medical professional, you are expected to use language befitting that of your training. Even other medical professionals, they expect this of you, and also they also expect you to understand them when they do the same. So in OET exam, definitely you need to learn all the terms and how to use them. So here you don't forget that you'll not only communicate with other trained medical professionals only. Half the time you'll be dealing with your patients or their relatives. So when you communicate with those who are not trained in the same field as yourself, means those who are not medical professionals, you will need to modify your language in order to get your message across. This is especially so in the OET exam, OET speaking subtest, where you're most likely to be doing a role play where you are the medical professional speaking to someone, usually a patient or the carer of the patient or the relative of the patient who does not have a medical background. So you will need to modify your language to ensure that the patient can understand what you are trying to say. For example, when telling another doctor or a nurse something about a patient, for example, the urine test came back positive for UTI. If you have to explain the same thing to the patient or the carer of the patient, then you have to avoid using positive, word positive. So because this can be wrongly constructed word for the patient. So you can say your urine test results show that you have urinary tract infection. Instead of saying positive, we just can say like this. Another example, the lump was tested as benign. So here you need to explain the word to the patient because otherwise patient may ask, do I have a cancer or not? Isn't it? So we can say like that, we have run some tests and the results have shown that it was non-cancerous or what we call benign in medical terms. So this is the way you can tell the same thing to the patient or the carer of the patient who is not medical professional. Third example, we need to test his little finger abduction. So here you need to avoid the word abduction, which is often associated with kidnapping. And this may confuse the patient if he thinks that someone wants to kidnap his little finger. So it's really funny, but the correct way of saying as a OET aspirant to the patient is, we need to test if you can move your little finger away from the other fingers comfortably or not. So this is the way. So same thing can be explained using the simple language. The next example can be the patient's LDL levels are slightly elevated. So if you have to say the same thing to the patient or a carer of the patient, we need to explain what LDL is. Basically, it's a bad cholesterol and you need to simplify the word elevated. This means you can say like this. This means that your bad cholesterol level, which we call LDL, is a little bit high. So these are the words you need to avoid because it can have negative impact on your speaking. Your patient would not be able to understand. So the next time you practice your OET, think about who is your audience hearing your message. And if you keep this in mind, you should be on the right track to not only passing your OET, but also becoming a valuable medical professional. I hope I have explained you things which are very important in OET speaking in a brief way. So please avoid using these negative words in OET speaking subtest and learn the correct usage of the words and the correct way to tackle the patient. So good luck for your OET exam and keep on practicing, keep on following us and stay tuned for the next video. Bye-bye.